There we go. So, here during this mini presentation, we will cover NIH guidelines, and I hope you guys can hear me well. Just give me a second. Let me move my computer much closer. So, a significant fraction of what I'm presenting today is actually adopted from the NIH website itself. So I'm trying to stick as close as possible to what NIH actually tells us and how this actually happens on the NIH review panels. So how does the NIH make the decisions which proposal is a good proposal or a bad proposal, and which proposal they would like to fund or not to fund? So this is really done through 5 or 6 criteria, I should say, and for each one of these criteria, there is a scoring section in place which is implemented, and the scoring is done from 9 to 1. So in the NIH scoring system, 9 means it's the absolutely worst proposal possible ever. So very rarely you see scores of 9, but sometimes you get to see 5, 6, 7. So this means the proposal is really, really bad. And 1 on the other end of the spectrum means it's the best proposal possible score. So this means it's an absolutely best and flawless proposal. Again, rarely you see a whole score of the NIH proposal being equal to 1, yet this happens. There are 5 key criteria how the proposals are scored at the NIH. The first one is significance, and again, all 5 of these criteria have the scoring system from 9 to 1, meaning 9 is the worst, 1 is the best. So these 5 review criteria are significance, investigators, innovation of the proposal, approach of the proposal, and environment of the proposal. Based on these 5 scoring criteria, an overall impact score will be assigned to the proposal. So this is a cumulative score which each reviewer assigns to the proposal, which is based on these 5 criteria. And it also ranges from 9 to 1. The bottom half of these proposals, or the bottom half of the proposals based on the scoring criteria, will not be even discussed after the initial review, and the upper or the better half of the proposals will be discussed. So why having the discussion minutes is important? Well, in case if your proposal didn't really make it, you will actually going to get valuable critique, which you can then use to improve your proposal in the next submission. So in case if your score was like 1 or 2, the reviewer is not obliged to give you any critiques. In case if your score was worse than that, you are supposed to receive some critiques which will help you to improve your proposal and really to improve your science. That's the goal here. So with these, we'll dive into the nitty-gritty details here. So the overall impact is your whole evaluation score of your entire proposal package. The NIH reviewers will provide the overall impact score to reflect their assessment of the likelihood of the proposal to make a sustained, powerful influence on the research field involved. So again, when you're trying to pick the topic for your proposal, again, think how you can develop a proposal which may have sustained, powerful influence on the research field involved. So the overall impact score, again, is based on these 5 review criteria. However, it is not an average of these 5 scoring criteria, but rather it's a synthetic or integrative or integral score of these 5 review criteria. So for example, some review criteria may have a larger, disproportionately larger weight on the total overall impact score. And respectively, this is a single score that will be decisive how good or how bad your application really is and whether it's going to get funded or not. So with these, we'll dive into 5 individual scoring criteria. The first and probably the most important one is significance. So significance is the importance of the problem that your proposal aims to address. A successful proposal must be significant. It must address significant enough topic. So in significance, we explain how the proposed research project will improve scientific knowledge, technical capability, and clinical practice in case if this is a clinical trial project in one or more broad fields. the questions that the reviewers and correspondingly by extension you, when you're trying to design your proposal or pick a topic for your proposal that you should be asking yourself is, does the project that you're trying to design or proposal address an important problem or critical barrier to progress in the field? Whether you are designing, for example, I don't know, a new technique, or whether you're trying to design a new drug, how important designing this new drug or new technique will be in the context of significance in a particular field. Next, if the aims of the project are really achieved and everything really worked out very well the way you envisioned, how will scientific knowledge, technical capability, and clinical practice be improved? In case, for example, if you designed a new drug, is that going to really change the clinical practice? And again, here, you really need to be kind of thinking in terms of the future, how a success of your proposal can improve clinical practice or certain scientific knowledge or technical capability. Perhaps your new tool will allow to do completely new things that were not possible to do before. And again, to give you an example, maybe you developed a new screening tool using using a new MRI technique. How is that going to change the practice? Finally, how will successful completion of the aims change the concepts, methods, technologies, treatment, services, or preventative interventions that drive the field? So again, these are the questions that the reviewer will be asking themselves within the context of your proposal. So significance of the proposal is described in the significance section of the main body of the NIH proposal text, which we call research strategy. So this is the main body of the proposal text. And it's this research strategy is the description of the rationale for your research and your experiment. So significance, again, is discussed in the significance section of this proposal. Moving on to the investigators, we'll cover it rather briefly. So not surprisingly, so this is the section where we describe the investigators themselves and the questions that the scoring questions or the scoring criteria that the reviewers will be asking are the principal investigators, collaborators, and other researchers are well suited for the proposals for the project. So what this really means, for example, in case if a chemist is trying to solve a critical problem, for example, that really a medical doctor should be solving, maybe this is not the best investigator for this particular project. In case if you don't have this particular expertise, what we normally do, we try to establish a collaboration with somebody else who does have that expertise. In the context of the proposals that you're trying to develop, what this really means, you really should try to find the proposals where you feel comfortable writing these proposals and the topics that you're feeling comfortable to embark on. So again, you being chemists, what we expect from you is you will primarily embark on the areas which are related to chemistry rather than, for example, I don't know, biomedical engineering. So if established, have these demonstrated ongoing records of accomplishments, if the early stage investigators or those in the early stages of independent careers, do these investigators have the appropriate experience and training? So these are, again, this is another question that the reviewers will be asking themselves. So the information about the investigators is provided in the biographical sketches and only succinctly summarized in the research strategies. Biographical sketches are submitted separately, and during this class, we will be designing these biographical sketches as well. So moving on to the innovation. Innovations is a criterion which is scored on how innovative your idea, approaches, or methods. So you may not necessarily have a innovation or innovative component in each one of those components, but you have to have some sort of innovation in your proposal. Whether this is related to the idea, perhaps your approaches which are using are completely even innovative. So this is where you describe your innovation, and innovation is the scored criteria. Very frequently, a lot of younger investigators make a mistake of trying to put a significant emphasis on the innovation where their proposals perhaps may look too ambitious. And this is another end of the spectrum. So in other words, the proposal may be so innovative that it may be too risky to embark on. So again, in the context of innovation, the questions that we ask ourselves: does the application challenge and seek to shift the current research and clinical practice paradigm by utilizing novel concepts, approaches, methods, or maybe perhaps new instrumentation? Are these concepts, approaches, methods are novel, at least in one of the fields, or novel in a broader sense? So again, this is what you should be asking yourself. Finally, and probably most critically, what the reviewers will be gauging, and what you should be gauging your proposal or your idea, is your idea a refinement, improvement, or a completely new application, or completely new theoretical concept, a new methodology? Why is that important? What NIH does not really like is NIH does not really like to see, and many other funding agencies, by the way, they don't like to see iterative research. They would really like to see potentially a breakthrough application or something of this nature. And that's what's really gauged and measured by the innovation of the proposal. Again, innovation is what we described in the innovation section of the research document, and it's a small section that goes into this document. Finally, sorry, not finally, the next one is our approach. So the approach is how well your approach or experimental strategy is designed to tackle the gap in the field. So the questions that we're asking ourselves are: the overall strategy, methods, or analysis are well reasoned and appropriate to accomplish the specific aims of the project. So in other words, how well you design your strategy to get from point A to point B. Have the investigators presented strategies to ensure a robust approach? In case if you're going to experience potential problem, have you thought about alternative solutions? Did you provide benchmarks for the success during your strategy? So this is the scoring criteria where which is really designed to gauge how well you designed your strategy to tackle the gap in field. Approach is described correspondingly in the approach section of the research strategy document, and it actually constitutes to a significant fraction of the research strategy document. The last, but and probably the least important, is the environment. So environment criterion is really ranks the environment where the research is conducted. So the reason why it's important is because NIH would like to see that the environment where the proposal is going to be performed, how positively or how negatively this environment may impact the research progress for the project that you are designing. So in other words, if you are trying to design a project which is like in one of the best institutions, that's fantastic. And that's what NIH usually likes to see. Environment is described in the equipment and facilities and other resources document, which is submitted as a part of the package. These two documents are not part of the research strategy document, and correspondingly, we will not focus on them during this class, but you really should know that the environment will be gauged as a scoring criteria for your project. Here, we kind of assume that all of these projects are done at Wayne State, where we have fantastic resources and fantastic facilities. I would like to finish my mini presentation with one more criterion, which is not related to NIH, and it's only related to National Science Foundation, so it's specific to the NSF, and it's called broader impacts. So this is a criterion in which NSF gauges the proposals. So according to NSF, broader impacts are the potential for your research to benefit society and contribute to the achievement of desired society outcomes. So here you really have to think about broader picture, how the projects that you're designing, if successful, will impact the society and society outcomes at large. So for example, in case if you're developing a new tool, I don't know, perhaps a new drug, you really need to describe how your drug will make a better world effectively. So for example, in case if this is a drug to treat cancer, you can easily describe that, you know, you're gonna help quite a few patients to deal with their cancer. You're gonna make society and people in the society to live longer, and so on and so forth. So, the key takeaway here, in case if the proposed science is really poor of your proposal, and I don't mean your particular proposal, of one's proposal, the superb broader impact statement will not necessarily save this poorly designed proposal. However, on the other hand, let's say you have a very well-written proposal otherwise, where you have fantastic science, but in case if you did not articulate these broader impacts to the reviewers, this poorly written broader impact statement can really sink good science. So what this really means, you really should advocate for your proposal. You really should explain to others why your proposal, why your research idea is important, why it can change the world in a very positive way. And it's really your duty as an investigator to perform this explanation, really to convince the others in a very concise manner why your proposal is going to make a world a better place. So I'm going to wrap up here in the